it's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Welcome back to this week's episode of Back to the Basics. I'm sure you guys have heard me say this, but 1.3 million people in the United States, women that is, enter menopause every single year. If you think that's an alarming rate, about 75 million women in the United States are either perimenopausal, in menopause, or postmenopausal right now. So odds are you know a woman that's having hormone issues. So today I have a very special guest, Aimee Neumann. She's a nurse practitioner. We are going to talk about hormones. We're going to talk about hormones from a Dutch testing perspective. So this is dried urine testing. We're going to talk about gut health and how important that is. And we are also going to talk about mold toxicity. So stay tuned. You're in for a treat. Aimee Neumann is a nurse practitioner with 17 years of experience and double board certified in women's health and functional medicine. After being diagnosed with stage 1 breast cancer at the age of 28, she embarked on a journey to uncover the true pillars of health. Passionate about empowering others, she specializes in helping individuals identify the root causes of their health issues, guiding them towards holistic healing and well-being. So very similar to what we do at Modern Endocrine. I'm going to link all of her stuff in the show notes so you guys can follow her on Instagram. She has some very interesting stories. But please help me welcome Aimee to Back to the Basics podcast.
Thank you, Dr. Cassie. I'm happy to be here.
Yeah. So we were just chatting before this started about how everyone meets in the world now. And so, we met on Instagram. So, we know people who know people on Instagram. So it's pretty cool. So even though she is in Minnesota, she knows people that I know. And so that's how we kind of got connected. And then I've been very interested in some of the stuff she's posted recently because we're getting into Dutch testing at Modern Endocrine, which is dried urine testing for hormones. And so her and I were just chatting about how unfortunate it is that a lot of women have hormone issues in this country, but can't get anyone to either figure it out or listen to them. And so if you're one of the many millions of women out there who are listening and you're having issues with brain fog and you're tired and you're having low sex drive and all of a sudden you have this muffin top and you're losing muscle mass and you have hot flashes, then know you're not alone and know that even though your labs are potentially normal, your blood labs, that doesn't necessarily mean that nothing's wrong. So Aimee's going to talk to us about that and some other testing we can do. So thanks for joining us.
Yeah, you're very welcome. So I think it's kind of important to talk a little bit about my backstory. So I practiced in conventional OBGYN medicine for 14 years before I sort of branched out to the lighter side of things. And I think this is becoming more well known now, but even my background, I'm trained not as a family nurse practitioner who just happened to work in women's health. I'm trained as a legit women's health nurse practitioner, but I did not feel very confident dealing with hormone issues when I came out of school because we just don't have very good training in that, And so over, my years of practice, starting to get more into functional medicine, things like that, I've done all of this hormone training on my own and sort of get really pissed off that as a women's health nurse practitioner, I was not very well equipped to treat perimenopause and menopause based on my training. And so that's why so many women in this country are struggling, is because to find someone who truly understands and does hormones well, you need to find somebody who has gone the extra mile and done a whole bunch of extended advanced education beyond what we're given in school. And so a lot of women get frustrated because their intuition is usually correct. They suspect that they are having hormone issues, but they go to their doctor and they're usually told, well, it's just normal, you just have to deal with it. It's just part of getting older, or they're just flat out refused any testing. And so that's how they end up in my office, right? And I do like to validate them and also explain, hormone testing is very nuanced and complex. And it isn't just as simple as let's just test your estrogen level, right? Our hormones are going to fluctuate depending on where we're at in our cycle. So it's just a very, very nuanced conversation to have. And I always tell them the easiest one to check is testosterone because it doesn't really change much throughout our cycle, right? So that part's easy. It's the estrogen progesterone piece that gets really complex. I usually tell them I will often try to troubleshoot some things with hormones because with my background, I've worked with hormones enough. If you give me your symptoms, I can usually maybe figure out what's going on. But if we're really struggling and we can't seem to figure out what's going on or can't seem to get you feeling better, something like the Dutch test can come in on the back end and be incredibly helpful for women. So, for your listeners who aren't familiar with it, the Dutch test stands for dried urine test of comprehensive hormones. So you're peeing, collecting your urine, using all of these test strips for an entire day, usually a 24-hour period. And you're doing it hopefully at a specific point in your cycle based on the information that we're trying to get. It's usually halfway through the luteal phase or like the second half of the cycle. So about halfway between when you ovulate and when you are going to start your next period. That's when we get the best data usually. So this test can give me some sort of idea of levels of hormones, whether they're maybe too high or too low. But what it's really looking at is the metabolites in the urine. So it's basically helping us to understand what is your body doing with those hormones. Not only how much do you have or how little do you have, but how is your body processing the hormones. I really like to use analogies for my patients a lot. So the analogy I use is sometimes we get kinks in our hose, right? And so the water can't flow through it very easily. So looking at the Dutch test can help me figure out where are those kinks. And if I know where they are, I can start to try to unkink them. And there's actually a specific order that we want to try to unkink them in too, because if you're unkinking it further up, but you leave a blockage closer to the edge of the hose, you're still going to get a water backup. You're not going to get very far, right? So that's really where there's a science to the Dutch test, but I think there's an art to interpreting it and implementing a treatment plan for patients as well.
Yeah. So yes, that's a lot of knowledge, a lot of information for our patients. But I completely agree. Like, I think it's really important to start with some blood tests, like you said, troubleshoot a few things. And then if there are certain things that just aren't, working, and hormones are very complex, like you said, like it's
Yes.
not just hormones, it's thyroid and
Right.
it's insulin and it's progesterone. And to your point, like hormones are really hard, estrogen and progesterone, because they teeter totter with insulin and cortisol.
Yep.
And so that's what a lot of providers forget or don't know or never knew or don't understand. Your estrogen and your insulin are very closely correlated. Your progesterone and your cortisol are very closely correlated. And so, you have to know what's going on with all of that. If you just do
Yes.
blood tests and you don't know what their insulin or their cortisol is, then, you can be way out in right field and you need to be in left field. But
Yeah.
I do agree, you can start with things like that. But then the other thing that's near and dear to my heart and yours as well is gut testing, right?
Yes.
So your gut is so important. And so I agree,
important.
like we do all these hormone tests and we do gut testing, but then sometimes you're still kind of like scratching your head or you're like, what is going on? So then Dutch testing is a great way to look at dried urine specimens for specific hormone levels at a specific time in your cycle to figure out how those hormones are breaking down, basically, right? Like how they're making different hormones and how they're being kind of excreted in your body. And so I think that's the thing that's important for people to know. And there's not very many providers that know what Dutch testing is or can even read one of these appropriately.
Correct.
And so in medicine, I joke that like if a provider doesn't know, then the answer is you must be crazy as the patient, right? Or like, it's just like most providers like, oh, well, I don't know that, so that's not right. And that's not how it should be.
Correct.
What should happen is we should say, okay, well, something's not right. You know yourself, let's figure it out. And so you've kind of taken that extra step to doing that with the Dutch testing.
Yeah.
So that's kind of in a nutshell what Dutch testing is. So tell me how important you think it is. So I tell my patients all the time how important gut health is, but I like for other people to say it on here so people don't think I'm just, drinking this juice on my own. Crazy person. But how important do you think, is gut health as far as when we're talking about hormones? Is gut health important? Is it important with thyroid? Like, Talk to me about that.
All of the above, 100%. It's so when it comes to hormones in particular, what most women don't understand, what I never learned as a provider, and I'm sure in medical school you didn't learn either, was there are multiple different phases in terms of our estrogen processing.
Mhm.
And phase 1 and phase 2 happen in the liver, but phase 3 really happens in the gut. So
Mhm.
you can try to unkink the hoses, you can try to work on supporting the liver, but if your gut is a mess, you're still going to run into major problems.
Yeah.
One of the most common yet easily fixable things that I have seen with my patients is just women who struggle with constipation. So they're just not having a bowel movement every day, and they come in presenting with hormone issues. It's usually always signs of higher estrogen, because what most women don't understand is our body makes the estrogen, our liver has to process it, it sends the excess metabolites into the gut so that we can eliminate it. But if you're not eliminating on a regular basis, then you're going to have this buildup of excess estrogen and toxins and all these other things, right? But so I have been able to help many women with their hormone issues, not by giving them any hormones or even really doing anything to address their hormones, but by addressing their gut health. And even something as simple as getting them going to the bathroom more often can actually have a lot of impressive downstream effects for their hormones. And then there's this whole, everybody kind of knows about the microbiome now, right? We understand we have all these, bacteria that are super beneficial in our gut, but there's something called the estrobolome,
Mhm.
which is how like certain parts of our microbiome really have an impact in how we break down and process our hormones, specifically our estrogen. So I think those are kind of the two easiest ways for people to understand how the gut is impacting the hormones. I think what's maybe a little bit more overlooked for some patients and a lot of providers is the inflammation aspect. And so if you have a lot of messed up stuff going on in your gut, you can have a lot of systemic inflammation or whole body inflammation stemming from that gut. And one of the reasons why women can struggle with their hormones is because of the systemic inflammation that they have going on. Not to mention, I think if you have a lot of gut issues going on, that can actually raise your cortisol, right? Because it's just a stressor that your body's trying to deal with. So now you've got the cortisol jacking up your hormones, jacking up your thyroid. We know that those are closely connected. And a lot of women will struggle with thyroid issues when their gut is not in balance as well. Because if your gut's not right, you can have nutrient deficiencies that can circle back and cause some thyroid dysfunction, right? If your gut's not right, you can develop autoimmune issues, and that's how you get your Hashimoto's driving your thyroid dysfunction. And then, most people don't fully understand thyroid physiology, where the thyroid gland's only making mostly this T4 hormone, but that has to be converted to T3, which is the active hormone. Now, a lot of that conversion happens in the liver, but 20% of it happens in the gut too. So it's all interconnected. And in functional medicine, we kind of learn this really cool pyramid where at the top of the pyramid is your sex hormones, your estrogen, your progesterone, your testosterone. But below that is your thyroid, your cortisol, and your adrenals. And at the very base of your pyramid is the gut, right? And it's not the tip of the iceberg that sinks the Titanic, it's everything below it. And so I usually tell my patients, if your hormones are off, likely it's that they're off in response to something else going on in the body. Now, if it's menopause, that's a whole different thing. We got to replace the hormones. And even sometimes in perimenopause, that's just the natural process. Sometimes we got to replace the hormones. But for younger women who maybe are not in perimenopause struggling with hormone issues, you really have to be looking at the thyroid, the cortisol, and the gut, because if you get those into better balance, then those hormones are going to kind of sort themselves out.
Yes. Did you guys hear that? In women, you hear that? Your hormones at the top may be in balance, but if they are not, you must look at the thyroid, the adrenals, and the gut in order to fix all of that.
Yes.
So all of my patients who come in and they don't want to do gut testing and they get, it's just my hormones, and I'm like, this is why, because the bottom of the pyramid is your gut, and it is so important. And it makes sense, right? Because like everything, I was having this conversation with somebody today, like we are supposed to eat to fuel our body. Most people eat because it tastes good, because they want to, because we forget that the point of nutrition is to fuel our body. And so the point of eating is to provide good nutrition to your body so that it can absorb nutrients from your food so that your cells have the things that they need to make energy, like vitamins, B vitamins, and CoQ10, and just all the things it needs to actually run through the ATP cycle and produce energy. Now, when we are feeding ourselves a bunch of garbage, or our GI system is inflamed for whatever reason, we don't get those nutrients.
Yep.
If you don't get those core nutrients, it's ridiculous to think that you're going to have anything in your body working well. Any hormone,
Yeah.
cortisol, sex hormones, thyroid hormone. And so that's why for me, it's really, really hard. We're doing a lot of membership type stuff at our clinic now.
Sure.
And we're probably going to get to the point where it's just membership based, because
Yeah.
I find it so difficult to take care of someone unless they will be all in. Like, I
Yeah.
can do a half-assed job of taking care of you with half the information, but I don't like that. Like, that's
Yeah.
not pleasing to me anymore, because
Yeah.
I did that for 10 years, right?
Yeah.
And people
Yes,
didn't get
same.
better,
Yep.
And so what I really want is, I want the whole thing. I want everything out on the table. Like, I want to know, what does your gut look like? What do your hormones look like? What are your like, let's get down to the bottom of it and fix it.
Yeah.
And so it's really important. And I think people forget that, like you said, we have this whole microbiome. We have this whole, like, just the way that our estrogen is metabolized in our gut is so influential to weight. I will tell you that, I've been doing I've probably done 200 GI studies recently. Most of them are people that have hormone gut issues, but a lot of them struggle with weight issues. Nobody has normal akkermansia. Like, this is a key organism for good gut health, right? Like,
Yeah.
nobody has normal akkermansia. It's like, what is going on in your gut,
Yeah.
And it's really hard to lose weight and to fix things when things like this aren't in line, right?
Yeah.
And so it's very important. And so I guess my question to you is, like, what are some things people can do to help fix their gut? Like, what are some easy things that people can do?
Oh, wow. Yeah, that's tough. I'm a big, big fan of like personalized medicine and like, let me do a stool test on you. Let me see exactly what you need. But I've also done hundreds and hundreds and hundreds of stool tests on my patients. And so there are themes that you start to see, right? A big, really common theme that I see is people aren't digesting their food well.
Yes.
Now, some of that can be because you're eating on the fly, you're not taking the time to chew your food properly, things like that. So just like sitting down when you eat, taking some deep breaths before you eat, chewing your food appropriately, those are all very simple and free things that you can be doing to make sure that you're breaking down that food properly. But I see a lot of patients come back, with low elastase, which is a marker on the GI map, which is a marker of your digestive enzymes. I give a ton of digestive enzymes in my practice. So things like digestive enzymes are easy and relatively inexpensive to try. I tend to use a lot of betaine HCl, which is like extra stomach acid support. That can be really helpful for digesting your food, because that's really where it all starts. You want to kind of work upstream, right? You want to optimize your digestion. I think a lot of people do really struggle with their good bacteria. Right? No Akkermansia, no Faecalibacterium. I know we're spitting out some big words here, but these are just like very important keystone species that should be present in your gut that are often very low or sometimes not present at all in the gut. And so I'm a big fan of using higher dose probiotics. I typically like at least 50 billion CFUs. I often use 100 billion CFUs for my patients. I typically use a blend of 3 different types of probiotics. I think there's so much confusion out there. So many patients ask me, I don't know what kind of probiotics to be taking. I don't know what's a good one, right? And it's tough. And that's where the stool test can kind of help us narrow that down for you. But I typically describe it as there's your kind of OG probiotics, which are like your lactobacillus, bifidobacterium. Then there's this newer generation of probiotics called soil-based organisms or spore-based organisms, a little bit stronger, can survive the digestive tract a little bit better, actually can really help to kind of kill off some things that maybe shouldn't be there. So I like to throw those in. And then there's a really nice product out there called Saccharomyces boulardii. Really long name, hard to pronounce, but that's a
Exactly.
benefit. Sac B. Yep, I call it. Yeah, I love it. So Sac B is actually a really beneficial yeast that acts as a probiotic and can actually help to kill some things in the gut too. So I kind of try, a lot of different companies are making different blends that have all three mixed in together in high doses. And I find that a lot of my patients have been doing well on those. Akkermansia is one that I do see really lacking a lot. And so sometimes I'll just periodically pulse in like a couple of months of just straight Akkermansia to try to build that up, because that is so important for our metabolic health and our weight. So I think you can't go wrong usually with a good high dose, high quality probiotic. And I think the other thing that I tend to give the most for my patients is something like colostrum or immunoglobulins, kind of depending on how much support they need in that area. If they truly have like a dairy allergy or really don't do well with dairy, you know, I might shy away from the colostrum potentially and go to the immunoglobulins. They can be a little stronger. But, you know, I think we've all kind of heard most of our immune system is in our gut. It's very true. And there is a marker on the GI map that kind of tells us how's that immune function doing in the gut. If it's really high, it's usually because it's really pissed off about something. You have a lot of infections and it's trying to fight it. But sometimes you have a lot of infections and you have very low levels of that immune marker. And we really need to work on building that up. And so colostrum or these immunoglobulin products can be really helpful there as well. And then I think the one thing that I really think that people don't appreciate so much, and I know that you will, is the impact that stress has on our gut. Like, you can load yourself up with all of these supplements, and these are great supplements, right? But if you don't have your stress in check, that is going to wreak havoc on your gut health.
Do you like what you've heard so far? If so, Modern Endocrine is now able to provide telehealth services in 8 states, including Arizona, Nevada, Oklahoma, Texas, Ohio, Illinois, Michigan, and Georgia. If you would like to become a patient, visit our website at www.modern-endocrine.com/contact. You can also email us at hello@modern-endocrine.com or call our office at 405-286-1571 to schedule an appointment. Please note, we no longer accept insurance for new patients. However, we do have customizable membership programs available. Your first visit will include a detailed intake, and lab orders will be provided to further assist us in developing your 10 stages to ultimate health plan. We do offer discounted lab rates with a nationwide lab service. And now back to the show. Yes. Yeah, I would say that my gut and stress put myself in check this summer. You know, I'm very good about what I eat. I have a clean diet. I'm a pretty healthy person, but when we were building our new clinic and moving, and I left a group that I was with, and there was just a lot of things going on, a lot of irons in the fire. There was a 2-month period where I just was not feeling very good recently this summer. And I was like, you know what? And so I did another GI map. I was like, well, I know it's not my gut, but guess what? It was my gut. And it was all stress induced. Like, when I got my GI map back, I was like, man, come on. But like, just like you said, I'm not sitting down to eat. So like walking up the stairs, eating in the middle of stuff, my elastase was low. I had a little bit of H. pylori. Just stress was just, you know, I had some candida. I was like, what the, you know? But I'm happy to say that I finished my gut protocol last week. I feel much better.
Oh, good.
Yes. So I think I fixed myself. I'm going to do another stool study. But to your point, it's stress related. Like, when you're stressed, you get a lot of really bad things that happen in your gut. I mean, it happened to everything, right? Your cortisol, your sleep. But really going, and I was doing a lot of mindfulness, and for like 2 months I got busy. And so I stopped, you know, I wasn't doing my morning mindfulness. I wasn't doing all the things I tell people on here to do. And so I got put in check for a couple months this summer, but I'm back. So yes,
good.
I would agree with you. Stress is huge on your gut, and sleep too, right? Because when you're not sleeping, and you're not sleeping consistently, that does cause stress, and it changes your cortisol level. And then I truly believe that cortisol and insulin affect a lot of what's growing in your gut, you know? So
absolutely.
what do you see as far as like when estrogen. So let's say when estrogen starts to change, because I see very vast differences in microbiomes with estrogen and without. So can you kind of speak to like when you lose your estrogen, when you lose your testosterone, what does that do to like the microbiome of your gut?
That's actually really interesting because I don't know that I've ever I work in an insurance system right now, so it's actually like pulling teeth for me to get some of my patients to do these tests, right?
Okay.
That's why I usually have to troubleshoot for them first and say,
Mm-hmm.
listen, my troubleshooting has not gotten us the results that you're looking for. Now it's time to actually like spend the money on these
Yeah.
tests because both of these tests that we've been talking about, the Dutch test and the GI map, are unfortunately not covered by insurance. And they're both several $100s. So, I get it as an expense for patients. But I guess I have not actually personally really stopped to pay attention. Okay, this is like a menopausal woman
Mhm.
versus this is a premenopausal woman. That's interesting. But I would actually be curious, like, what have you noticed?
So when you start to lose your estrogen, your microbiome, just like the good guys, just they dwindle. It's crazy. Like
I
they're
do
just
know that the
not
literature
as
supports that.
yeah,
Yeah.
it's so true. Like when you go through menopause and your good guys start dying, you get a lot more bad guys. I would say also for whatever reason, after menopause, I see more yeast overgrowth and I see a lot
Mm.
more pancreatic insufficiency, which is interesting because I know there's a lot of literature that shows that estrogen does make your microbiome more robust, right?
Hmm.
So, and then also it makes sense, right? Your insulin levels go up when you lose estrogen, right? When you go through menopause, when your insulin's high, you're going to crave a lot of bad stuff. When
Yep.
you're eating a lot of sugar-based bad stuff, you're going to have more bad guys that are growing, right?
And the yeast. Yep.
The yeast. So it's very interesting, like what I
Yeah.
see based on hormones and how they change. And just fixing someone's hormones helps their gut a ton. So it's pretty
I
fascinating.
have actually had several patients who I've talked about, okay, well, you've got you're menopausal, we need to get you on hormones, you've got these gut symptoms. Let's figure out your hormones and then, we can tackle the gut later, but several of them have felt like they don't need to tackle the gut anymore because just going on the hormones has helped resolve like their bloating or their heartburn or whatever.
Yeah, and when your insulin's high, you're going to be more swollen. You're going to have
Mhm.
more hot water retention and bloating type symptoms. But then also, I find too, and I haven't even looked at the literature, but this is just women that don't have estrogen are much more constipated as well. So, like, if you
Oh,
have somebody
interesting.
who's like lost all their estrogen, they tend to be more constipated, especially my PCOS girls. I saw a couple of them today.
Mm,
PCOSers actually can have high estrogen or
yeah.
they can have lower estrogen. Same thing
Mhm.
with testosterone. When you get these PCOSers with really high testosterone, really high estrogen levels, like super high, they have diarrhea, not even on
Oh,
metformin. But
interesting.
then whenever they have maybe high testosterone, but when their estrogen is low and their progesterone's low because their cortisol's so high and their insulin's high, they're constipated. It's the weirdest thing.
Interesting. I'm
And
gonna
so
have to
that's what
start to pay attention to that more.
yeah, that's what I've seen is like when your hormones are really low, they get constipated. But when they're high, a lot of times they'll get diarrhea. And I wonder if some of it is the way your estrogen, is
Is
digested and absorbed in
Yeah,
your gut. So when you've got a
possibly.
lot of it, you've got a lot more stuff moving around. And so you get more diarrhea, but it's pretty fascinating.
That's so
Um,
interesting.
yeah. So that kind of segues me talking about estrogen in the gut and whatnot into the Dutch testing. So whenever you do have somebody and you can't figure things out and you do the Dutch testing, when do you find that it's like most beneficial? Is it most beneficial with PCOS people? Is it just when you can't figure out what's going on? Is there like certain symptoms that you typically want to use it for? Like what have you found?
Yeah, I think a lot of it is because I'm an insurance-based practice right now. It's usually, okay, we've been trying all these other things and we can't seem to figure it out. I will say the few situations when I found it most helpful are in women who I have started on hormones,
Hmm.
usually menopausal women, because I've brought in, they're on estrogen, progesterone, and testosterone, and they're not doing well with their estrogen, particularly some of my pellet patients, my hormone pellet patients, and they just kind of balloon up and they're just not feeling good. If we get your hormone dosing right, you should be feeling good. But if they're just really, really struggling with side effects, then I have found the Dutch test quite helpful, because it's usually there's at least one kink in their hose that I have to go in and try to unkink for them. So we're giving them all of this estrogen, and their body is just like paralyzed and it can't do anything with the excess. So that's when I have really found it most helpful. Also, actually, in the setting of like uterine fibroids, endometriosis, because usually they have some estrogen processing issues as well that we need to sort of try to rebalance for them.
So people that get really bloated with hormone therapy, and or just around, the time of their cycle, people that aren't, cycling normally, endometriosis, you said, uterine
fibroids.
These
Yeah.
are
PCOS,
people
I do
that,
find it helpful in PCOS usually too. Yeah.
what about acne? Like people that struggle with a lot of acne?
Yeah, acne's a real tough one, as you
Yeah.
probably know for sure. The Dutch usually isn't always my go-to if it's my first visit with a patient and they're complaining of acne. But I'm also really trying to figure out, does this sound more like hormonal acne? Does this sound more like, man, they're just eating a really crappy diet and we got to start to clean that stuff up first?
Bingo.
Yeah, because acne can have, I always say this, I can have 10 different women in this room with acne, and they can all have different root causes for their acne. I find a lot of acne can be driven by gut health issues. Yeah.
I would agree.
Yeah.
So I guess what I should have said is, if you have a woman who you've looked at their gut health and they are eating
Yeah,
pretty
sure.
clean, then the Dutch test sometimes, like I saw a girl today and I think it was helpful, because we were seeing that, oh wow, you're not even really processing your testosterone correctly, like,
Yes.
different things like that. But
Yes.
okay.
Yeah, the
So
testosterone metabolites on the Dutch test can be very helpful. So for your listeners, there's really like two main pathways that our body can metabolize our testosterone. Even as women, we need testosterone, right? And one of them is called the 5-alpha pathway, and that tends to be more what we call androgenic, or causing things like hair loss and acne and things like that. So that usually tends to light up quite high in women with hormonal acne issues.
Yeah. And so for people listening, if they think, oh, maybe that's me, maybe I'm a 5-alpha, reductase, is there things they can do for that? Or do they just give up and say, oh, no more testosterone?
No, definitely not. It kind of depends on the patient and what they've tried already. I'm always looking at inflammation markers too, because that's going to drive that pathway a little bit more. If they do struggle with insulin resistance issues, that's going to drive that pathway a little bit more. So we need to figure out if we need to address those things or not. But on the natural side, things like zinc, things like saw palmetto can be really helpful, stinging nettles. So we'll bring in some herbs. Or sometimes people have to go to some prescriptions like a spironolactone or something like that if it's just really bad and they're not responding well to some of the other non-hormone or non-prescriptive methods.
Yes, but for the people listening, it's important to realize she said after we clean up your gut, meaning we're not eating a bunch of garbage, and we're trying to get rid of gluten and dairy. Dairy is a huge causer of acne in women.
Dairy and sugar.
People can get as mad as they want. You can throw things at me. Like, I get it. I used to think that cheese was its own food group, like staple in my life, and I haven't had it for 2 years. But I also haven't had acne issues for 2 years, and I also haven't had sinus issues for 2 years. And I also, so acne is or dairy is a huge indicator of acne. Or
there are people who look at me like I've just told them their first child has died. If I tell them, I really think you should just at least try eliminating dairy to see if it helps with your symptoms.
That was me 2 years ago. I was like, I don't think I understood what you just said to my functional medicine provider. I was like, I don't think you understand. Like, my fridge is full of 20 delicate cheeses. Like, I mean, it is a staple in my life, I don't even.
I am actually 13 years dairy free here.
Oh, wow.
Yeah, 13 years gluten and dairy free, almost. And I actually don't miss them. It was hard in the beginning, I'm not gonna lie. It was a challenge. But when I realized how much better I felt without them, it's like
Mhm.
not even a thing anymore.
No, you don't even
Yeah.
care.
No,
So do you care if I ask, was it gluten and dairy free after this stage 1
it
breast cancer
was.
diagnosis? Is
It
that what
was.
happened? Okay.
Yep. Yep.
And so then is the Dutch testing also beneficial for people who maybe have estrogen metabolizing issues or are concerned
Yes.
about the way they metabolize estrogen?
100%. And so I am a very open, flexible provider more so than others. And I am always willing to work with people and meet people where they're at. I see myself not as a dictator. I'm here as your educator and your guide. And so I do have some women in my practice who have had breast cancer who I have on hormone therapy, but one of my requirements is you will do a Dutch test so that I can see, usually before and often usually after we start hormone therapy as well, so that I can see what your body is doing. Because there are, for the listeners, there are certain metabolites of our estrogen
Mhm.
that can, if they're too high, can potentially increase the risk for a breast cancer developing. Now, some of that can be medication induced. A lot of it is driven by genetics. And as a breast cancer survivor, I do a Dutch on myself, usually about every other year right now, because I'm just very, very early in perimenopause. So my hormones haven't been changing a lot. I kind of know what they're doing. I'll probably start to do it yearly on
Yeah.
myself going forward. But I do happen to send slightly more than I should those metabolites down what we call this 4-OH pathway. But there are things that I do to help try to push them down a more protective pathway.
Like dim?
Yeah.
Yeah, so actually that's a good point. So I am the same as you. I do not feel like I'm a dictator. I don't feel like I'm put here to dictate anyone's care, just to give them advice, cheerlead them, and then do what they feel is best. So I also have lots of women in my practice who have had cancer, who are
Mhm.
on hormones, who have had all different types of cancer. Because I'm not one to believe that if you are so miserable you would rather die that you should be, denied hormones, especially with
Yes.
all the research coming out showing how actually safe it is if you do
Hmm.
it in the correct doses and the correct frequencies and the correct concentrations. But that's a
Yes.
whole nother
Whole
animal.
nother
But
podcast.
what I do with women who have had breast cancer is we check estrone levels in the blood to make
Yeah.
sure they're not making a bunch of
Yep.
estrone, which why medical traditional oncologists don't check this in women is beyond me. Why don't we check it in every woman is beyond me. Kind of like lipoprotein A when we go through menopause. Like these are just things that you should know. Do you have
Yes.
lipoprotein A and are you an estrone maker? I
Yeah.
mean, that's just like, it's kind of like, what is your vitamin D or what is your sex? I mean, you should just know these things.
Yeah.
But to your point, I think it is a good idea to start checking Dutch testing on women who have had breast cancer to see how their hormones are metabolizing. Like
Yeah.
that's a great idea so
Yeah.
that you can help. And not saying that you would stop the hormones per se, but you could at least try to shunt them to do
Exactly.
better things, right? Because
Yes.
what I like to tell my patients is I could give you, Aimee, hormones and I could take them myself and we can both metabolize them very differently, right? Like
Yeah.
everyone's going to metabolize things differently. That's why everyone's kind of an in-a-one and I'm with you as like individual healthcare. And so without knowing how you metabolize your hormones, it's hard to treat some of those people. So that's a good idea. So Summer, if I know you're listening to this, my nurse practitioner, you're about to do a lot of Dutch testing, sister, because all of our patients who have had cancer need to have some Dutch testing, I think. So
Yeah. And I think it helps make them feel better too.
yeah, it
And
does
I
for sure.
always preface it and say, you know what, I'm not going to guarantee you that just, you might be metabolizing your estrogen beautifully and you
Mhm.
still could potentially have a recurrence, right? I'm never going to promise that. But at least they know, okay, well, this is one thing that doesn't seem to be stacked against me.
Right.
Right. And I think it's also important for your listeners to understand, I don't want people who have had breast cancer to just rush out and think, oh, my Dutch test looks fine, therefore I'm probably not going to ever get cancer again. I can use hormones, right? Because I'm also, if you are in my practice, and I'm sure the same for you, and you've had breast cancer, we're not just looking at your hormones. We're looking at your insulin and your cortisol and we're looking at all the things because it's
Mhm.
not just the hormone piece. Like there are so many things that will go into your risk of that cancer returning. So we're trying to minimize all of your risk factors.
Yeah, and what you brought up earlier, the word inflammation, like that's
Mm-hmm.
the biggest risk factor. Your
Yes.
weight, your inflammation, and your age. Like,
Yeah.
and you can't do anything about your age, but you sure can do something about your weight and your inflammation. And that's the
Yes.
problem, in this country is just everyone's walking around as this giant ball of like inflammation, like somebody needs to do a TED talk on that. Like inflammation is the root of all evil.
Yes.
How can we fix it? Maybe that'll be
Yes.
my TED talk for 2025.
There you
But
go.
inflammation is a huge.
Yeah.
So yes. So all of this is great information. This kind of segues me into the last question I wanted to talk to you about because you do a lot of this, and this is why I originally kind of reached out to you is mold. So
Yes.
mold kind of goes hand in hand with all of this, and there's lots of people I see who think, oh, maybe I have mold, but let's talk about mold toxicity like on a high
Mm-hmm.
level. Like, what is
Mm-hmm.
it? What are some of the symptoms? And then when should we think about testing it, and maybe what sort of tests like you and I were talking about? There's two different schools of thought when it comes to mold.
Yes. I will try to keep mold is such a complex topic, so I will try to keep it as like high level as I can because I
Yeah.
can easily go into the weeds here. But mold toxicity is a very, very real thing, and anyone who says it's not has never treated patients with mold toxicity before, right?
Mhm.
So, the classic way you're going to end up with mold toxicity is from a water damaged building.
Mhm.
And a lot of times when I work with patients, if I'm starting to suspect mold and I might ask them about it, I'm met with one of two scenarios. Either, nope, I live in a brand new house. Nope, that's not me. They're like full stop, hard denial of it. And I say, okay, we can move on. Or I'm met with, holy shit, yeah, I always thought that that building I worked in or that dorm I lived in college was a disaster, or there was mold growing along the wall, or so I feel like either people, they kind of know or they're in complete denial. But usually it's water damaged buildings is going to be your primary source of exposure. And I think the big misconception is you can't always see the mold. The mold can be hidden. Okay. I have had many patients who have sworn to me up and down that they don't have mold in their current house, but once they actually go digging, they find it. It's usually like a dishwasher leaking is very common, or I had a patient who, when they moved, they remodeled the bathroom, tore out the shower surround. There was black mold everywhere. Windows can be a big issue for people. So it's sometimes subtle. So if you've ever had leaking issues in your house, just flooding issues, water damage issues in your house, mold is something you might have to be concerned about. Now, mold affects everyone differently. There are a lot of people who can live in a water damaged building and have that mold exposure and be totally fine. And that's what also makes it challenging, because you can have an entire family living in the same house and maybe only one person is actually sick from the mold. So those of us who do tend to get sick from the mold, usually we genetically have some issues where our bodies just don't detox it very well. Or there's, a lot of times it's, I find people with a history of trauma because their nervous system is so dysregulated that they just see everything as a flight or as a fight, right? So it's very, very complex in that way. Now, typical symptoms that make me think about mold, this can really run the gamut too, which is why it's so difficult to diagnose, because it's not like the same set of symptoms that we're taught in school, right? A huge issue for me is if you have a lot of gut issues, that you're working with somebody like us, we're running the stool tests, we're giving you the protocols, and you're just not getting better. Or sometimes it sounds like or it feels like we're playing whack-a-mole in your gut. Like we might get rid of something here, but something new pops up. That's a huge sign that there's mold issues, because mold has a huge impact on the gut. Another key thing that I'll ask people is, when did you start to not feel good? And if it's, oh, it happened, in this year, I haven't felt well since this year. Okay, what happened? Did you start a new job? Did you move? So if your symptoms all started after you moved into a certain house or started working in a certain building, that's another really classic sign that we might be dealing with some mold exposure. But I'd say gut issues, fatigue, brain fog, thyroid issues, joint pain, hair loss, hormone issues, especially with too much estrogen or symptoms of high estrogen. Those are all things that kind of make me think about mold for patients. But the tricky part is every single symptom that I listed could have at least 6 other different root causes to it as well. So I usually tell my patients I have some spidey senses for mold because I've worked with it enough. So by the end of my first hour with you, if I tell you you have mold, I've been right 100% of the time. Because it's just this clinical picture, and once you start to treat it and see it more, the pieces start to click together. But sometimes I work with people and mold is not anywhere on my list of potential diagnoses, and it's not until we've been working together for a while, and it's, again, things just aren't doing what they normally should do. Or another kind of classic symptom is when people tell me, gosh, I take melatonin, which should help me sleep, but it keeps me wide awake at night. So that's called like a paradoxical reaction. Like I take this thing, but the opposite thing happens. That I see a lot in my mold patients too. So that usually raises my spidey senses.
Okay.
Yeah.
So that's interesting. So then I can think of a few people off the top of my head that maybe
You're like, oh shoot, she probably has mold.
Yeah, well, no. So, it's true. Like if you're working with somebody and you're really doing what you're supposed to, and you really, like, I fixed your hormones and you're doing what you're supposed to for your gut, and you're still just having a really hard time, then maybe that's something to think about. And so for you, one of the symptoms too is fatigue. Like if you just have debilitating fatigue despite changing your diet and despite sleeping. And so then you would think about maybe some mold.
Yeah. Yeah, because
Okay.
mold, going back to what we were talking about before, mold actually creates a lot of inflammation in the
Mhm.
body. So
Mhm.
the thing that people don't understand about mold is it's not so much the mold itself. So if you imagine, oh, sorry, my dog's kind of making an appearance here. If you imagine like an area sitting next to you that was growing some black mold, right? It's not that black mold that's causing the issue, but that mold is releasing what we call mycotoxins. I call them mold farts for my patients. You can't smell it, you can't see it, right? But it's this noxious substance that you can then inhale and it gets transported all over your body. And so it's the mycotoxins that cause all of the inflammation and cause all of the damage. And they really tend to hit people in their weakest areas, right? So for a lot of people, it's their gut. For a lot of people, it's chronic sinus issues or their asthma, or they have lots of allergies. For some people, it's their thyroid. For some people, it's their hormones. So it depends on sort of what's already going on in your internal biochemistry. And it also depends on the type of mycotoxins that you're being exposed to, because different mycotoxins are known for causing damage in different areas. Like there's a certain one called zearalenone, which your listeners don't have to remember, but that one is notorious for causing hormone issues. And there's another one that's notorious more for causing like kidney issues. So that's another sign too. Sometimes I'll see like seemingly healthy patients, but their kidney function is not good. And it's like, what? There's nothing else to explain this. Then I'm usually thinking about mold toxicity as well.
Okay. Very,
Yeah.
very interesting. And
Yeah.
and I get that too. And you know what's crazy is in Oklahoma, where I live, there's a lot of mold and people don't realize it because it is so dang humid here. And
Yes.
people will have these brand new houses, but I hate to tell you, unless you had a real good contractor, and even if you did have a really good contractor, I mean, you can't, humidity, things like that happen, right?
Yeah.
And so I do think that mold is probably something that's underlooked.
Yes.
I have thought about it more recently now that I've been doing gut stuff. And because like you said, I can fix you 99% of the time. Like
Yeah.
if you'll do what I say, and that's so awesome when you have these people and they come back and they feel so much better. But
Yeah.
every now and then I'm thinking of a couple people right now where I know they're doing what I tell them to do. They come in and they're just not maybe getting better. Those are the people who you're like, okay, we need
Yeah.
to look at this. We need
Dig
to
a little
address.
deeper. Yep.
And here's the other thing that I think a lot of people like, let's say we think somebody has mold toxicity. Does it mean that everyone that lives in that house will have the same symptoms?
No, not at
Exactly.
all.
And I
Yes.
think that's where a lot of people get like, well, nobody else in my house has those symptoms. Nobody else like, well, not everyone has your body and like
And
everything
that's,
that's going on
yeah.
in your body.
Just like I said, it'll depend on what type of mycotoxins and what's already happening with your internal biochemistry and where your sort of weak links are. That's where it's usually going to hit you.
So if somebody is thinking like, oh, maybe that is so again, fatigue,
Fatigue, brain
lethargy.
fog are big ones, lots of gut issues, some hormone issues, lots of food sensitivities or food allergies. Another thing that I haven't mentioned yet is people who are extremely sensitive. People who have, we call it multiple chemical sensitivity. Like you walk down the laundry detergent aisle at Target and it gives you a headache, right? Things like that also makes me think of mold issues or lots of histamine issues. Now, histamine, everybody kind of thinks of related to seasonal allergies because we take antihistamines, but I have a patient that I just saw last week who I'm fairly certain she has mold. I've talked to her about it before. She's kind of not ready to go there, which is fine. We can't force that. But every time she eats avocado, she turns bright red and flushes because avocado is a high histamine food, right? She struggles
Mhm.
with seasonal allergies. She struggles with a lot of gut issues. She's lots of bloating, things like that. So people who really struggle with histamine related issues often can have mold driving those histamine issues. Not always, but very
What about
often.
rashes, like unexplained rashes?
Yeah,
Because of a
unexplained
food
rashes
allergy.
that can be tough because that can be food allergy, food sensitivity, but the food sensitivity could be driven by the gut dysfunction caused by the mycotoxins, right?
Mhm.
So rashes aren't always related to mold, but could potentially be.
Okay.
Yeah.
So if somebody feels like, maybe I have a
Maybe
mold,
like some of this is resonating. Yeah.
maybe I take melatonin and it makes me wide awake, or even something like that. Then, so we were talking about this. There are two schools of thought with mold. There is
Yeah.
urine and there is blood.
Yes. So
What do
first of
you do?
all, yeah, let me back up and say for anyone out there thinking, "Oh my gosh, this sounds like me. I should get tested." You cannot unfortunately go to your regular primary doctor and ask for a mold test. None of this is recognized by conventional medicine. So you are going to have to search for more of a functional medicine provider, and not even all of us in functional medicine know how to treat mold. It's like you have to have your classic training, your functional medicine training, and then you have to do even more training on top of that to understand mold. Okay, so you do have to do your research and try to find providers. Okay. But I am of the camp, how I was trained is I use urine testing it's called urine mycotoxin testing. So I will often sort of do a provocation, which means the night before you collect your urine sample, you're going to either sit in a sauna, take a really hot Epsom salt bath, or use a supplement called glutathione to make sure that we're trying to push these things out into the urine. Because some people struggle because their body doesn't detox them very well. So
Mhm.
it's actually not unusual to do a mold test on a patient, have it show moderate levels, and then we work on some treatment. Maybe 6 months later, we repeat the test. That second test can often look worse than the first test. It doesn't mean that their mold issue is worse. It means that we've actually enhanced their ability to excrete them and detox the mycotoxins out.
Mhm.
So that is a very real thing that we see. So urine testing is what a lot of us will use. There's three main companies out there, and there's all sorts of debate on which company is better. They all use slightly different methods, but any of them are something's better than nothing, right? Now, there's this other school of thought, which I am not as well versed in, but that is a blood test. It is not a blood test you can get through your regular doctor or LabCorp or Quest. It is a test called My Mycolab, MYCOLAB, and it was created by this doctor named Dr. Andrew Campbell. And that is looking more at antibodies to different mold toxins. Now, unfortunately, those two schools of thought, the people who believe in the blood testing and the people who believe in the urine testing, they kind of don't always agree with each other and kind of talk shit about each other. So, um,
not good.
personally,
Because
which
I
is
want to
not
go
good,
along.
but yeah. And it's not really like that extreme. It's more like I don't agree with what he says and vice versa. I don't agree with what he says, right?
But have
So
you ever done both of them on a patient? Like, are they both valid, or you don't know?
yeah,
Like,
I personally have not. I'm
okay.
in a mentorship group, and I think there are some patients or some providers out there who have, and find them both sort of helpful in interesting and different ways. So, as Dr. Cassie and I were kind of talking a little bit before we came on, with mold in general, I think the general consensus is because it's not really recognized by the conventional system, there's not a lot of funding, there's not a lot of research out there. There is research on mycotoxins and how they damage various different systems, 100%. But in terms of the treatment, this has become a lot of us providers who kind of go rogue and just start to treat this, and we're just starting to throw things at the wall and see what sticks. And it seems like certain things tend to commonly work. But even mold patients can be very hard to treat because every mold patient that I have has a slightly different treatment plan because they often are very sensitive and can't always handle the supplements they even need to get better. Certain supplements they will respond to, certain ones they won't. So we're constantly having to change things up. And they usually also have other underlying issues that we're trying to manage at the same time as treating their mold toxicity. So
Yeah.
it's very, very nuanced. And a lot of us who are out there doing it, we're all kind of trying to band together into these mentorship groups to sort of share experiences and knowledge and research that we come across so that we're all trying to just further the treatment of our patients. And we just want to help people get better.
Yeah, it sounds very complex.
It is.
It's sad because it's kind of like gut health stuff too, right? Like gut health's a little more mainstream in functional medicine, but I would still say that a lot of it is just people trying different things and then kind of putting their heads together and saying, at least for me, I have providers reach out to me all the time and say, "How did you learn how to do gut testing? How did you learn?" And the answer is I kind of just did it. Like, I mean,
Yeah.
that's crappy, but it's like I knew patients needed it. I did it. And then I started treating them based on what literature said or what, and then I adjust it based on what I've learned. So how I treat it
Yeah.
now is not the same how I treated it 6 months ago, and like that's just unfortunately kind of how medicine is. And it's
Yeah.
like cooking, right? Like there's a recipe, but there's little modifications that go into it.
Yeah.
So what I'm telling you is I'm kind of sad that we had this conversation because it seems like something I would love. So now I feel like there's something new I need to learn, which is mold toxicity. Because that's like I mean, if there's something out there that's like complex and hard to fix and like, but there's a way to fix it, I'm all in. Cause like I love that. I love peptides. I love ozone. We do some cool stuff with ozone in the gut. I don't know if you've ever done any ozone with like
I
your
don't have
gut.
it in my clinic.
Oh,
I have wanted
amazing.
to explore that for a while because I know that there's some really cool stuff you can do. Even actually you can use ozone for mold treatment for some people. They will
Okay.
respond really well for it, IV ozone.
So see, I mean, I was like, and so there's just some cool stuff I've done. Microdosing GLP-1s for
Oh,
inflammation does
yes.
amazing. And when I
Yes.
say microdosing, I mean true microdosing, like
Yes.
0.05 milligrams, zero point 0.1 milligrams of semaglutide, like
Yeah.
one unit, not like
Yeah.
zero point 0.5. Like, but I mean, there's some cool stuff you can do. So now I feel like I'm going to end up in this rabbit hole about mold in the next 2 months. My team's going to kill me because I promised them we weren't going to do anything new for the rest of the year.
Well, you only
But
have a few more months and then it's 2025, so you can just wait until January and then you didn't technically lie to them.
my husband and my clinic manager, Josh, and everyone's like, no more new stuff, Cassie. And I'm like, but patients need it. And they're like, no.
And
um,
honestly, I got into it only because this was my story. I have been working on my gut for years and I did chemo and I know that that wrecked me and I've had gut issues my entire life, but I was working with my own functional medicine provider and I was getting better, but it was still like, why can't my gut just like get past this threshold? So I finally just on a whim tested myself after learning a little bit about it. And sure enough, I tested positive for mold. So it was me just digging in to figure out how do I help myself. And then I started to like see some trends in patients and then it just kind of spiraled.
okay.
Yeah.
So yeah, so that's very fascinating. So that's a whole nother avenue besides hormones and besides Dutch testing and besides gut health is is mold toxicity. And
Yeah.
so I just wanted people to kind of be aware that that is something you can do. There is this camp of people that believe in blood testing, but most people are
Most
going
of
to
us do
talk about
urine.
urine testing, and then that there are actual ways that you can treat it, which are
Mhm.
supplement based, some ozone
Yeah.
based. What are
There's
some other ways?
ozone. Yeah, it's a lot of supplements. We use things called binders, which are things
Yeah.
like activated charcoal that will bind onto these mycotoxins. So I use a lot of like charcoal, chlorella, bentonite clay. But a lot of it is also like a lot of patients think that, well, I lived in a moldy dorm in college, but I'm not living there anymore and I don't suspect mold issues currently. Why am I still having these issues? And so a lot of times what happens is we will colonize mold within
Mm.
us, which is really fascinating, usually in our sinus cavity. So people who
Mhm.
just have a ton of sinus stuff and lots of sinus infections, that's a real big red flag for mold for me, but we tend to colonize it in our sinuses and in our gut. And so then you can be living in the most pristine environment, but you are now your own walking source of mold because you have colonized that mold in your body, and that mold is continually producing these mycotoxins. So the mold is like the fire and the mycotoxins are like the smoke. So in treatment, you have to deal with the smoke, which is you bring in the binders to bind onto that smoke or those mycotoxins to pull them out. But you also often have to go in with antifungal therapy. Now,
Mm.
for some patients, I will try to use herbs for that if they're very, very sensitive. This is one case where I like to be natural and use herbs when possible, but I actually often find that prescriptions work better. So I will use prescription antifungals for my patients, and that's when I usually see them start to progress and get better.
But when you're doing that, I'm assuming you're supporting their gut with good, healthy, like probiotics
Yes,
and
usually
food
we're
and
supporting their
nutrition.
gut. We have to pay attention to their liver if they're on certain antifungals for a longer period of time. So it's not just mold toxicity. Like in order to treat mold, you really have to like sort of become an expert in all different areas of the body.
Yep, sounds right up my alley. No, I'm just
Yeah.
kidding. Uh, so, so, um, in that being said too, when you're treating mold, just like when you're treating the gut, I think it's also
hmm
important for people to realize in order to clean yourself out and detoxify yourself, you must detox, meaning you must poop every
Oh,
day and
gosh,
you must
yes.
sweat every day.
Yes.
And I think that's
Yes.
one of the things that people like look at me and they're just like today I talked to two people. I did some gut reviews with this lady and she's like, I'm Dr. Cassie, I'm never going to poop every day. And I'm like, sister, you are. And I mean, you have to, to clean this up, you know? Well, I never have my whole life. Well, that doesn't mean that's normal, you know?
Yeah.
And so sweating and, having a bowel movement is how our body detoxifies. Like that is how it
hmm
works. And so getting people on that like train of like, if I'm not doing that, that's a problem. Because I feel like most women especially feel like, well, if I go twice a week, that's great. And it's like, no, that's not great.
That
Like
makes me
you've
like
got,
cringe a little.
I know, like think of all those nasty toxins that are just recirculating
Yes.
in you. Like, come
Yes.
on.
And the interesting thing
So
about that is, some of my mold patients are my most constipated
yeah,
patients
for
because
sure.
the mold impacts their gut to such a degree, or they end up with like issues with their vagus nerve, which is this major nerve that
Mhm.
innervates our gut. And if that isn't working properly, you can struggle with constipation issues. But that is the real sort of conundrum is I need you to be having bowel movements more often in order to really help to detox you. But because of the mold, you can't have bowel movements. So sometimes I have to throw everything at them. And I do not love this, but if it's a mold patient, I say, I don't care if you have to take Miralax for a while every
Yeah,
day. Like you have to
yeah.
do something in the beginning to get you moving. And then, with these binders that we bring on board, ironically, I'm always leery about giving people binders if they're not having bowel movements regularly. But some of my patients, that actually gets them going more often, which has been very cool. But for some people, it constipates them more. So then we have to say, whoa, whoa, hold on. We got to pause. We got to then work on something else first.
The same thing with GI stuff, right? When you start giving people IgA or IgG, and like when you start giving them binders or trying to give them immunoglobulin, same thing. Some people I find it constipates, but some
Yeah.
people it actually. So again,
Yeah.
individualized medicine. Like there's,
Yeah.
I have so many people that reach out to me on social media. So if you're one of those people that are listening to this, it's not that I'm trying to be an a-hole and not answer your question, but it's like I can't answer that question because there is not a generic protocol for fill in the blank. Like I
Correct.
have to know so much else of what's going on. Like, can I give you what
Yes.
I typically do? Maybe if you give me what else is happening, but like, I might treat H. pylori. Like I have people ask me all the time, how do you treat H. pylori? It
It
depends. Like there
depends.
are 4 ways to treat it, 5 ways to treat it. And it all depends on like what's going on. And if you just pick away and have at it, I mean, you got a 20% chance of getting better. That makes me look like a real idiot,
Right.
like
Right.
I know how to fix it, but I have to know everything that's going on.
Yeah.
And so
And
it's
also
just,
just in general, I think with the advent of social media and so many healthcare providers being on social media, this is just a tip for like patients out there. I get it. We want to help you. That's why we're here. But we cannot give you medical advice over social media. I just refuse. I
yeah,
will not do it. You can't.
yeah, it's true. And so
Yeah.
as much as you want to tell us your life story, we would love to help you, but we can't on social media, which is
No.
why Modern Endocrine has a license in 10 states now. We actually got a medical license today in Pennsylvania as well.
Oh,
So now 10
nice.
states. Yeah, so we do a lot of telehealth stuff, but
Yeah.
yeah, and I'm hoping to one day maybe have one in all states, and that would be awesome. But
Yeah, exactly. We just need
anyway,
more providers like us
we
now.
yes. Which brings me to the next point. You're still taking insurance? Like, how does that happen? Like, how do you do you in an insurance world? Would,
It
would
is
you like
tricky.
to move to Oklahoma City and come be a part of Modern Endocrine? We do not take
uh,
insurance.
yeah, and I actually had this conversation with a patient today. Most functional medicine clinics, it's not that insurance doesn't cover functional medicine. I mean, they will not cover like the mold testing or the Dutch test or the GI map. But how I do it is in the insurance system, I bill for my time. So I bill for the time that I spent with you. And there is no code for mold toxicity. So for
Yeah.
patients out there, when you see us as a provider and we submit things to insurance, I have to use this special fancy code. And so, like there's a code for fatigue, there's a code for brain fog, there's a code for constipation. So I just tell your insurance company, hey, I'm seeing her for fatigue, brain fog, and constipation, and I spent 45 minutes with her, right? And your insurance will reimburse me for that visit. Now, a lot of functional medicine clinics don't do that because one, it is kind of a pain in the ass to work with insurance. I don't think that's a big secret out there, but you have to also have people who know how to work with insurance and know how to do the billing side of it. And so that's, as a practice owner, that's another expense that we have to deal with. And sometimes that expense is not always worth it. I think the interesting part is there is in my area up here, she was actually in Western Wisconsin, but there was a functional medicine provider who was in an insurance-based system for a very long time. But because all of her visits were long, right? My shortest visit is 45 minutes with a patient. It's usually 45 minutes to an hour. The insurance companies don't like to always reimburse at those higher rates. And so they came back and said, you bill too many of these extended visits. So going forward, no matter what you bill, we're only going to reimburse you no higher than this level. And so her system said, you can no longer spend 45 minutes or an hour with your patients. You need shorter
Mhm.
visits. And she actually left. She left and started her own practice that's not
Right.
in the insurance system. So it's very complex and nuanced. And it's sometimes hard because I'm going to be very honest. Sometimes the patients that come to me, I don't think they're fully committed, right?
Mhm.
And they're not willing. And sometimes, and it sucks that it is this way, but some of this stuff does cost money, and I always try to keep budget in mind when I am making treatment plans for patients. I always try to not do more tests than I feel like are necessary, but sometimes I need that data, and that does require money to be spent.
Yeah, I mean, your health is an investment. That's what I
It
tell people all
is.
the time. And whenever you allow an insurance company to dictate how your health is, is ran, then that's where I have a problem. There's a middleman there. And I did take insurance until July of this year. And what I
Mm,
found was when I did take insurance and I did try to bill fatigue and brain fog and things like that, I would get pushback. I would get, they didn't want to pay or they would take forever to pay. And then they
yeah.
didn't pay. And then my patients would get a bill, but it would be 6 months later and they would be mad. And it's like, well, I spend an hour with you. Somebody has to pay me. And so it's just like you said, I'm just like, okay, I'm done playing the middleman. I'm happy to give you whatever, and you can submit it to your insurance, and you can see the headache and the runaround that causes. But it is frustrating that
It is.
it is so frustrating that there is a company out there or somebody on the other end of something that says, no, Dr. Smith, even though you're a dual board certified endocrinologist who's actually helping this patient get better, I'm sorry,
Yep.
denied. I'm not going to
Yep.
pay that. And it's
Yep.
like, what? I went to school for like 15 years. And so it's very frustrating.
Yes.
But to also to that point, I just tell patients like it's an investment in your health,
Yeah.
take it or leave it. Unfortunately, I hope in 10 years it's different, but
Yeah.
I'm off my rant. If you would like to come to Oklahoma or there, but yeah, Modern Endocrine would love to have you. You teach them how to be old and I'm sure our patients here would love you. And it's not as cold as where you live either. I'm just going to put that out.
Yes. Yes.
Yeah.
Now it was like, for your listeners, it's the end of October, and in Minnesota, it was 80 degrees today. That is very rare. So I don't know. Check back with me in mid-January and it might feel
Maybe you'll come to Oklahoma then. You're like, I'm
Yes,
out.
exactly. I'll winter in Oklahoma.
We'll take you. Okay. Well, that was very informative. Thank you very much. We may have to just have a whole session on mold in like 6 months or something.
We could, believe me.
After I go down that like mold train.
Yes.
Sorry, Josh. Sorry, Summer. Okay. So I keep my promises though. No mold this year. I end my podcast with 3 questions, and people love this. So don't overthink it. It's easy. I just want whatever comes to mind. But number 1, what is the one food that's most beneficial and why?
Oh, gosh. I mean, the first thing that came to my head was broccoli.
Okay.
Or broccoli
why?
sprouts, I guess.
Okay.
Because it's a good source of fiber, right?
Mm-hmm.
It's in the cruciferous vegetable family, and we know that that's very beneficial for hormone health and for overall just supporting your liver detox pathways. And broccoli sprouts are like even more powerful for those things than the actual broccoli. So I guess I'll go with broccoli sprouts.
Okay. The only other person that said that is Dr. Corey Rice. He's a BioT provider. Somebody I talked about hormones. And he said
that makes sense.
I actually currently have a Instagram video that we put out with he and I trending where he said that. It's got like a bazillion views. I don't know why, but people
interesting.
Lost their mind about broccoli sprouts. So that's funny that you say that.
Fantastic.
Okay.
Yeah.
Broccoli sprouts. Okay. Number 2, what is one thing that anyone can do that would benefit their health that's absolutely free?
Meditation.
Okay. And I like that. I don't get a ton of that, but I agree. Like, do you have a specific amount of time or way of doing it that you think is the most beneficial?
Any way that will make you consistent with it. Because that is the key. It is, I tell my patients this all the time, it is called a meditation practice for a reason. You're not going to be good at it in the beginning. So if you sit down to meditate and you're like, I couldn't completely silence my thoughts the very first time I did it, that's like saying I couldn't run a marathon without training for it, But because I think that stress is just such a big issue for our health. And so I'm just a big, big believer in the power of meditation.
I agree. And everyone has monkey mind. So keep that in mind. So that means when you sit down and you try to meditate, your mind will wander, thoughts will come in. You let them come in and then you let them go right out. Everyone has monkey.
Yes, everyone does. I've been meditating for 10 years regularly, and I still have sessions where it's just all over the place. But it's developing the awareness of your thoughts and the awareness that you are separate from your thoughts.
And for those of you out there who are very, I wouldn't say ADD, but just very like have a lot going on in your head, have a to-do list that's a mile long all the time, feel like you're always behind. Meditation's actually really good for you. It's hard to start. And the way I would recommend is staring at a lit candle. So if you stare at a lit candle, it's hard to think about anything else. So you sit comfortably in a dark room and you just focus on that candle, and you try not to, again, if something comes in, you let it come in and come out. But if you're focused on something, that's how I started doing it. And it's helped me a ton too, because I would sit and I would be quiet for 30 seconds and then my to-do list would be like ding, 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 ding. And I'm like, damn, ding, 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 ding. So, but if you're looking at something, then it's better. So
Oh, I like that. So what I tell patients is start with guided meditations, because there's so many free ones on YouTube, Spotify, the apps that they have, right? Because then you still get to think. It's just that somebody is directing where those thoughts should be going.
Sometimes that works for people. For me, it doesn't, because when I hear a voice, then I like somewhat like let it, kind of drift out here, and then this part's doing this. So yes.
Oh, sure. So now you have both. You can try the candle or you could try the guided and figure out which one works best for you.
Because I'm the person that's like always multitasking, so I'm like, okay, I can hear this and figure this out and be thinking about this and like, dang it, no, Cassie, no. So
you can't.
Candle. Okay, and then the last question, if there is one thing that you could have done differently for your health 15 years ago that you know better now, what would it have been? What would you have done differently 15 years?
Oh my God. So it's really interesting for me, since I was diagnosed almost 13 years ago, and I have completely changed so much about my life. I'm also really bad whenever anybody asks me to pick one thing, because I'm just like, I can't ever pick one. So I'm going to give you two.
Okay.
It would be figure out my gut, because it was messed up since I was a kid, so it would be figure out my gut, and it would be sauna.
Yep. I think those are both awesome. Sauna and gut. I like those. I think honestly, my number one is sleep. I think that as a provider, we are just taught just to be so bad to ourselves, and I never prioritized sleep until probably 2 years ago. And I look back now and I'm like, I don't know how I functioned, like I am just so much more in tune with myself. Like today is a prime example. We were traveling yesterday, got back last night, did a later workout. This morning I woke up like I always do, 5 o'clock. I do my red light, I go my cold plunge. I literally drove to the gym, Aimee, got out of my car, walked into the gym, got on the treadmill for like 2 minutes. And I was like, I am so gosh dang tired. This is just pointless. I got back in my car, drove home, and took another hour-long nap before I went to clinic.
Good for you.
Because I was just like, I'm going to have a pissy workout. I'm going to be in a bad mood. I'm tired. So I'm just going to go back to sleep. And 2 years ago, I would have never done that. But now it's like, I'm tired. I'm going to go to bed. I'm going to take a nap. I took a nap. On vacation last week, I took like 3 naps. Like, I've never done that before. Like, but I was tired.
Good for you. Yeah, that's awesome. I love it. I had a personal trainer once tell me, your body, because I used to get up at like 4:30 to work out, and my trainer was like, your body is going to thank you for that extra hour of sleep more than it will thank you for that workout.
I agree.
And that has stuck with me.
I agree. This morning, I'm telling you, I just would have been in a bad mood. It wouldn't have went well. So when we get done with this, I'm going to take my dog for a walk for like 45 minutes. I'm going to call it a day.
Perfect.
So
awesome.
Okay. Well, Aimee Neumann, thank you so much for joining us on Back to the Basics. I'm going to link all your stuff in the show notes. So guys, we'll put all of her stuff in the show notes. If you don't follow her on Instagram, you should. I'll make sure we put her information there. And I just appreciate everything that you do for patients. So thank you for, being one of us functional medicine people out there on a limb. And just thank you for, trying to learn about mold and take good care of patients. We need 1 million more of you in the world.
Yes, we do. We really do. Because any functional medicine provider, out there, we are all like maxed out, right? Like we can only help so many people. So thank you so much for having me. This has been a real treat. It's been an honor.
Yeah. All right. And if you guys liked this show, make sure that you please are following us. Leave us a review. I really appreciate reviews. And then if there's anyone you think this could help, any woman out there that may have issues or anyone that you think are having gut issues, please share this with them. We would appreciate it. And remember, Modern Endocrine is now available in 10 states, and we do virtual appointments in those 10 states. Have a good day. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.